How often should you pee? A urologist explains what's normal. How many times did you pee yesterday? 4 times? 8 times? Maybe 12? For many adults, around 6 to 8 times in 24 hours can be completely normal. But here's something much more important than the number. How much urine comes out each time? Because someone who urinates 12 times a day and only passes tiny amounts may have a completely different problem from someone who urinates 12 times and produces a large amount every time. One pattern makes me think about the bladder, prostate, or urinary tract. The other makes me ask why your body is producing so much urine in the first place. So if you've ever wondered, am I peeing too much? I'll show you exactly what I look for as a practicing urologist and which warning signs I wouldn't ignore. How often is normal? Let's start with the simple answer. For many healthy adults, around 6 to 8 bathroom visits per day is a useful reference point. But it's not a rule. 5 times can be normal. 9 times can be normal. Even more can sometimes be normal. Because your bladder doesn't work independently from the rest of your body. If you drink more, you'll usually pee more. Coffee and alcohol can affect your urinary habits. Certain medications can increase urine production. And on a hot day, when you're sweating heavily, you may actually urinate less. So I don't diagnose a bladder problem simply because someone tells me I pee 9 times a day. I want to know the whole pattern. One of my first questions to patients with frequent urination is, how much are you actually drinking? I've seen patients drinking 3 or even 4 liters every day because they believe they need to constantly flush their kidneys. Then they're worried because they're going to the bathroom every hour or 2. But if you put that much water into your body, your kidneys have to get rid of it. So before worrying about your bladder, take an honest look at your fluid intake. Small amounts or large amounts. This is probably the most useful part of this video. Imagine 2 people. Both urinate 12 times every day. The first person goes frequently, but only passes a small amount each time. That makes me think about things like an overactive bladder, a urinary tract infection, bladder irritation, or incomplete bladder emptying. In men, an enlarged prostate or another form of bladder outlet obstruction can also contribute. Now, take the second person. They also urinate 12 times, but they produce a large amount every time. That's a different situation. Maybe they're drinking too much. Maybe they're taking medication that increases urine production. But excessive urine production can also occur with medical conditions such as diabetes. So, 12 bathroom visits doesn't tell me enough. The volume matters. This is why one of the simplest tools in urology is also one of the most useful, a bladder diary. For 2 or 3 days, write down when you drink, how much you drink, when you urinate, and approximately how much comes out. That's it. I've had patients tell me, I'm constantly peeing. But once we look at their diary, we sometimes see immediately what's happening. Tiny amounts every hour is one pattern. Large amounts every hour is another. The symptom sounds identical. The underlying problem may not be. What about peeing at night? Now let's talk about nighttime. Getting up once during the night to urinate becomes increasingly common as we get older. But regularly getting up 2, 3, 4, or more times is something worth looking at more closely. We call this nocturia. And especially in men, there's a common misconception. Nighttime urination does not automatically mean your prostate is enlarged. I often hear, "Doctor, I get up 4 times every night. It must be my prostate." Then I ask, how much urine comes out? If you're producing a large amount every time you get up, your bladder may simply be filling normally. The more interesting question is, why are you producing so much urine during the night? Evening fluid intake can contribute. Certain medications can contribute. Sleep disorders and other medical conditions can contribute as well. So nocturia is not automatically a prostate problem. coffee and just in case, peeing. There are also two very common things people overlook. The first is caffeine. If you drink several coffees, energy drinks, or large amounts of tea throughout the day, this may worsen frequency or urgency in some people. The second is constantly going to the toilet, just in case, before leaving home, before driving, before a meeting, before going shopping. Occasionally doing this is completely normal. But if you're emptying your bladder every time you feel the slightest sensation, you may become accustomed to urinating at smaller bladder volumes. Patients sometimes tell me, "My bladder has become tiny." Often it hasn't. They've simply become accustomed to responding very early to the sensation of bladder filling. In selected patients, gradually increasing the time between bathroom visits can therefore be part of bladder training. But don't deliberately hold your urine if you have significant pain, infection symptoms, urinary retention, or another known urinary problem. When should you worry? Now we get to the most important part. For me, one of the biggest warning signs is a sudden change. If you've urinated 8 times a day for years and feel completely well, that's very different from suddenly going from 4 or 5 times a day to 12. And certain additional symptoms matter. If frequent urination comes with burning or pain, think about a possible urinary infection. If you have a weak stream, difficulty starting, or a feeling that your bladder isn't empty, that deserves evaluation. If you're suddenly producing very large amounts of urine and you're constantly thirsty, talk to your doctor. And visible blood in your urine should not simply be ignored. Finally, if urinary symptoms occur together with fever, shaking chills, and severe flank or kidney pain, seek urgent medical evaluation. An infected, obstructed kidney can become a medical emergency. So, are you peeing too much? Here's what I want you to remember. Don't obsess over one exact number. Instead, ask yourself 4 questions. How much am I drinking? Am I passing small or large amounts? Has my urinary pattern recently changed? And do I have any other symptoms? For many adults, around 6 to 8 times per day is completely reasonable. But your individual pattern matters much more than whether you urinate 7, 8, or 9 times. If you're still unsure, keep a bladder diary for 2 or 3 days. It can tell you much more than simply counting bathroom visits. And if you're urinating frequently and it burns when you pee, that's a different situation. That combination can point toward a urinary tract infection. I've made another video explaining exactly how to recognize a UTI and when it can become more serious. Watch that video next. I'll put it here on the screen. Thanks for watching, and I'll see you in the next video.